I'd like to start off by just saying thank you for including us here on the panel from the state of California. And I think in this case we might have taken a page out of the great state of Ohio, when it came to antimicrobial resistance. And by that what I mean is sometimes we find that if you get behind the discussion, you're not really getting to define the solution. And that's happened to California several times in animal agriculture. We're a proposition state, so sometimes we get behind the discussion and we don't get to define the solution. So that happened with cage size for poultry, for example, with Proposition 2. So when it came to antibiotic use, there was a lot of motivation by all of the potentially impacted partners to recognize the significance of the topic and become involved in coming up with the solution. So I'm going to just go over real quick. Senate Bill 27 was passed last year in California. It has, to simplify it, it really has three main parts. It limits the use of antibiotics to certain circumstances. Quite a bit of it is similar to what's happening federally, and I can go into a couple details of that. But the fortunate thing is it's going into effect the year after the changes that are going into effect that FDA is instituting, which helps our producers comply. The other part of it is it does require my department, the Department of Food and Agriculture, to work on some stewardship guidelines, which I'll get into, and as well as it requires us to institute some monitoring and surveillance related to antimicrobial resistance, which I'll talk just real briefly about those different areas. So starting out with the limiting use, it's quite similar to FDA 213. There was a lot of debate, though, as it went through the process with a lot of stakeholders coming to the table. For example, when you start with what does it apply to, what animals does it apply to? Currently in law it says, basically livestock includes species that are held for profit. So what does that mean for equine, for example, and things like that? There's a lot of discussion over why doesn't it include pets. Actually, veterinarians in California were supportive of extending some of the practices and requirements to pets, but that did not move forward for a number of reasons. So right now it's livestock. And then there was a lot of debate over what antibiotics should be included in our law. And, as a producer, all you would want is every state to have different list of antibiotics, right? Good luck. And that does sometimes happen in California. But in this case, we were able to come to consensus that we really ought to have a consistent list, and FDA probably is the most qualified agency to determine what that list is. So we did adopt Appendix A of Guidance for Industry 152. And then the similar to the, under the oversight of a veterinarian, similar language has been adopted. There was a lot of debate, and I've heard it mentioned this morning, and it comes up quite a bit, on the appropriateness of using antibiotics in livestock for prophylaxis. And you can imagine that was in California as we went through the legislative process. There was certainly a lot of input on that. And in the end, our law does allow for prophylactic use of antibiotics, but some of the compromises, there are some restrictions to such use. So for prophylaxis related to surgery or other procedures, there's no problems with that. Otherwise, in the opinion of the veterinarian, pretty much would allow treatment using prophylaxis. So in other words, our veterinarians need to have good records and explain why they feel that it's needed, which should not be a problem if you're practicing competent veterinary medicine. And then there is some language about not using it in a regular or repeated pattern, which I think there were, we could imagine some of the advocates, what they didn't want to see is prophylactic use replacing growth promotion, which I don't believe that's anyone's intention. The one thing that was a little bit different in California that will be pretty interesting to enforce is it went beyond it's not just antibiotics used in feed and water, but also over-the-counter labeled injectables and boluses like PPG, tetracycline, etc. Those also now have to only be used under the oversight of a veterinarian. So in that one instance, California probably has gone beyond what's being implemented at this point nationally. So what that brings up is availability of veterinarians and availability of drugs, and because there isn't a pharmacy, in every town and every corner in some of our more remote areas of California. So we're working very closely with our Board of Pharmacy and with others to ensure that the animals that need antibiotics can still have access to those antibiotics. And then we also do have some enforcement clauses in our law. Most of any enforcement related to veterinary practice will continue to be done under our Practice Act through our Board of Veterinary Medicine, and other enforcement would mostly occur through our department. So the second part of it is stewardship. That's technically, we should have started working on that January 1st of this year, so we're almost a year behind. The bill wasn't funded until July 1st of this year, and we're just moving through hiring, so we should be able to start working on what stewardship is. But basically, it's pretty broad, the language in the bill. And again, there was a lot of discussion there. Some advocates wanted to see regulatory stewardship, which to me is kind of like the legislature practicing medicine, which I don't think anyone would really be in support of including the legislature. Thank goodness. But so right now it's a best practices and guidelines that our department's directed to work on. And it's pretty a full range. People ask me all the time, well, what does that mean? I think that's what we're struggling with and discussing here today. That's yet to be seen. But basically it includes both antibiotic use as well as husbandry practices. And there was examples given this morning, for example. That's the exact type of thing we're going to be looking at. And of course, it will be species and production type specific. I spend a lot of time explaining that to my physician friends that, okay, that's one species, and you have a hard time comparing your hospital stewardship program to your outpatient, to your VA stewardship program, to your, other stewardship programs. Imagine, now put yourself in our shoes and think of how big our task is when we want to try and grapple with this concept of stewardship. And I think that helps quite a bit for them to understand that. And then it also does have specific language about using scientifically validated principles when we're looking at stewardship. So monitoring, the third kind of leg of the legislature, third and last, is it directs us to start gathering data on antimicrobial use as well as other practices, and it requires that we work with our federal agencies, which we like because it doesn't waste taxpayer resources, so we're not overlapping work. And it requires that we gather not just sales data, because everybody knows we've talked about that to death. That really is meaningless if what you really care about is resistance. If what you care about is trying to mitigate resistance, gathering sales data may or may not help that at all. So we're intending to gather deeper data, so the kind of like questionnaires like we might talk about later, that type of work is what we're looking at doing. But how do you slice that pie? We're struggling with that. There's been a lot of initiatives going on nationally that we're looking at very closely and hoping we can partner with. Probably some of the most significant parts of the law, which will probably make it very, very effective, one of them is that it does provide for confidentiality. So just like California is similar to every other, well, you might disagree, but we're similar to every other state in the country in that our citizens really value public information and access to information, and we support that. But in this case, there is confidentiality clauses built into the law because there was a clear understanding of the veterinarian, patient relationship should be, valued and respected. And then also, we felt like we might get skewed data and inaccurate data if people were hiding things from us. So by having confidentiality in there, we're confident that we can get very good data that will really help us inform stewardship as we move forward. And we're directed to work with willing participants. And there's a lot of skeptics that say, well, how are you going to get unskewed data if everybody has to volunteer to give it? You can't just go get it. Well, we've come up with some different matrices that we plan to use to judge ourselves, to make sure that we are getting statistically significant samples and good valid data that really represent our full plethora of livestock in California. And we've had experience with that in the past. And if you have a trust relationship, you can do it. And we have done that in the past. So, the proof will be in the pudding, but I'm confident that we'll be able to get good data. And the last thing is we do need a report to our legislature in 2019. So that's kind of driving our program forward to try and get there. So what now? Just almost my last slide. We're working extensively with stakeholders. This is a very iterative process. We've really tried to reach across the board to broaden all of our awareness of issues and try and come up with the best solutions rather than just one myopic look at the solutions. And so we're including the health department, veterinarians, producers, consumer advocates. We've had a working group going for several years now. In fact, we developed a white paper before the legislation even came out so that we could influence perhaps some of the things that the legislation looked at. So phase 1 funding we've received, I mentioned that already, 8 positions, just about $1.4 million. So it's rare that people demand something and then put their money where their mouth is. But our governor does believe this is a serious issue for the future, preserving antibiotic use for our future generations, animals and people. And there was pretty broad support to put funding into this, and it's general fund, because this is a one health issue. It doesn't need to be laid on any one person's back. We as a group in California are going to help fund this and move forward. There's still more work to do. This initial phase 1 funding, it's a big vision, and that phase 1 funding probably won't be enough to get it done. We need the federal government to get funded. Our request for funding depended on them getting funded, so it'll really not happen if USDA and FDA don't get funded to work on this issue. And we do believe there needs to be a phase 2 funding as well, which is in the works. So my last slide I'm going to share is, I think it's probably the theme for years here at NIAA. And that star there in the middle says trust, if you can't read that in the back. The top is producers, and the 2 bottom circles are, one says consumer advocates, one's veterinarians. And in California, that's what we found was the biggest issue was building trust so that we can be open and honest and try and come to a solution together. And that star there is, when I talk to my staff, I say, that is you. You are in that star, and your job is to build that trust and build those bridges. So that's our vision, and hopefully in the future I'll be telling you how successful we are, or I might be looking for a job. So that's it.